Question 1. A patient undergoes a diagnostic mammogram of the left breast, including craniocaudal, CC, and medial lateral oblique, MLO, views. The patient has a history of breast cancer in the right breast and presents with a new palpable lump in the left breast. A. 77067 LT. B. 77066 LT. C. 77065 LT. D. 77067. Answer: B. 77066 LT. This question tests your knowledge of diagnostic mammography coding, specifically distinguishing between screening and diagnostic services. The key phrases palpable lump and history of breast cancer indicate this is a diagnostic study, not a routine screening. Diagnostic mammography involves looking into specific concerns, and CPT code 77066 correctly represents a unilateral diagnostic mammogram. Remember that modifiers like LT are crucial to specify the side of the body studied. Question 2. A patient presents for an abdominal ultrasound due to right upper quadrant pain. During the study, the radiologist visualizes the gallbladder, liver, common duct, pancreas, spleen, and kidneys. A. 76,700. B. 76,705. C. 76,770. D. 76,775. Answer: A. 76700. This question focuses on abdominal ultrasound coding and identifying the correct code based on the organs examined. The description lists multiple organs in the upper and lower abdomen, including gallbladder, liver, pancreas, spleen, and kidneys. CPT code 76700 represents a complete abdominal ultrasound, which includes evaluation of these organs. Code 76705 is for a limited study, which wouldn't cover this many structures. Always check the report to see if the study was complete or limited. Question 3. A patient requires fluoroscopic guidance for a lumbar spinal injection procedure. The radiologist provides the imaging guidance. How is the fluoroscopic guidance typically coded? A. Included in the injection code, not separately coded. B. Coded separately using an imaging guidance code, e.g., 77003. C. Coded only if contrast is used. D. Coded using a supply code for the contrast agent. Answer: B. Coded separately using an imaging guidance code, e.g., 77003. This question assesses understanding of imaging guidance coding, specifically for non-vascular interventional procedures like spinal injections. While some minor imaging is included in certain procedures, fluoroscopic guidance for these injections is typically a separately billable service performed by the radiologist. CPT code 77003 is specifically used for fluoroscopic guidance during spinal procedures. Always look for documentation of imaging guidance provided and confirm if it's included or separate per CPT guidelines. Question 4. A patient receives an MRI of the brain with and without intravenous contrast. The contrast was administered by the radiologist during the study. A. 70,551. B. 70,552. C. 70,553. D. 70551, 70552. Answer: C. 70553. This question tests the coding for MRI studies when contrast is involved in the same session. CPT guidelines often provide combination codes for imaging performed with and without contrast. Code 70553 specifically covers an MRI of the brain performed both without and with contrast administration. Avoid coding the without and with codes separately when a combined code exists. Question 5. A limited CT scan of the abdomen is performed focusing only on the kidneys for suspected kidney stones. Contrast was not used. A. 74,150. B. 74,160. C. 74,170. D. 74,176. Answer: D. 74176. This question requires careful reading to identify the correct CT code based on body area and scope. The phrase limited CT scan of the abdomen focusing only on the kidneys is the key detail. CPT code 74176 is designated for a CT scan of the abdomen focusing on a specific area, like the kidneys, as a limited study, and it specifies without contrast. Code 74,150 to 74,170 represent complete abdominal or abdominal/pelvic studies. Question 6. A patient undergoes a chest X-ray including PA and lateral views. A. 71,045. B. 71,046. C. 71,047. D. 71,048. Answer: B. 71046. This question focuses on basic diagnostic chest X-ray coding based on the number of views. The question specifies PA and lateral views, totaling 2 views. CPT code 71046 is used for a chest X-ray with 2 views. It's important to count the distinct views documented in the report to select the appropriate code. Question 7. A patient receives a bone density study, DEXA, of the spine and hip due to osteoporosis. A. 77,080. B. 77,081. C. 77080, 77081. D. 77,085. Answer: A. 77080. This question tests your knowledge of bone density coding, specifically for central bone density studies. CPT code 77080 is for a dual-energy X-ray absorptiometry, DEXA, study of the axial skeleton, spine, hip, radius. While the question lists both spine and hip, 77,080 covers both sites when performed together as part of the central study. Code 77081 is for a peripheral study. Question 8. A nuclear medicine bone scan is performed on a patient. The study includes whole body images. A. 78,300. B. 78,306. C. 78,315. D. 78,320. Answer: B. 78306. This question is about coding nuclear medicine bone scans based on the imaging extent. The phrase whole body images is the crucial detail here. CPT code 78306 is specifically for a bone scan with whole body imaging. Code 78300 and 78315 are for limited or multiple area scans, not whole body. Always check the nuclear medicine report for the scope of the study. Question 9. A patient undergoes an ultrasound of the scrotum. A. 76,856. B. 76,857. C. 76,604. D. 76,641. Answer: B. 76857. This question tests your ability to identify the correct ultrasound code for a specific male anatomy. CPT code 76857 is specifically assigned for an ultrasound of the scrotum. Codes like 76604 and 76641 relate to chest or breast ultrasounds, respectively. Knowing the codes for different body parts is essential in radiology coding. Question 10. A patient presents for a follow-up study after a previous angiogram. The radiologist performs selective catheterization of the right renal artery and obtains diagnostic images. A. 36,251. B. 36,252. C. 36,253. D. 36251, 75722. Answer: A. 36251. This question involves coding selective catheterization and angiography, a key area in interventional radiology. The procedure involves selective catheterization of the right renal artery and diagnostic imaging. CPT code 36251 includes the selective catheterization of a unilateral renal artery and the necessary diagnostic imaging. The imaging supervision and interpretation, SNI, is bundled into this code. Question 11. A radiologist dictates a report for a chest X-ray performed at the hospital. The radiologist owns their private practice and is providing the interpretation service for the hospital. Which modifier should be appended to the CPT code for the radiologist service? A. TC. B. -26. C. -50. D. RT. Answer: B. -26. This question tests the understanding of professional and technical components in radiology billing. The radiologist's service of interpreting the images and dictating the report is the professional component. Modifier -26 is used to indicate that only the professional component of a service is being billed. The hospital would typically bill the technical component, TC, which includes the equipment and technologist time. Question 12. A patient has a non-tunneled central venous catheter inserted by a radiologist under fluoroscopic guidance in an outpatient setting. A. 36555, 77001. B. 36556, 77001. C. 36,555. D. 36,556. Answer: A. 36555, 77001. This question involves coding central venous access device placement with imaging guidance. CPT code 36555 is for the insertion of a non-tunneled central venous catheter. Because the radiologist used fluoroscopic guidance during the procedure, the imaging guidance is typically coded separately with 77001. Remember that imaging guidance is often a distinct service when provided during procedures unless the CPT code explicitly states it's included. Question 13. A patient undergoes an abdominal ultrasound. The documentation indicates a limited study focusing on the gallbladder only due to suspected cholecystitis. A. 76,700. B. 76,705. C. 76,770. D. 76,775. Answer: B. 76705. This question again tests abdominal ultrasound coding but emphasizes the scope of the study. The keyword limited and the focus on the gallbladder only are key. CPT code 76705 is used for a limited abdominal ultrasound study, which is appropriate when only a few specific organs are evaluated. This contrasts with the complete study code 76700. Question 14. A physician orders a unilateral diagnostic mammogram of the left breast for a patient with a history of a benign cyst in that breast. The radiologist performs the study. A. 77067 LT. B. 77066 LT. C. 77065 LT. D. G0204 LT. Answer: B. 77066 LT. This question reinforces the distinction between screening and diagnostic mammography. A history of a benign cyst indicates a reason for a diagnostic study to specifically evaluate that breast, not a routine screening. CPT code 77066 represents a unilateral diagnostic mammogram. Code 77067 is for bilateral diagnostic mammography, and G0204 is a HCPCS code for screening mammography in specific situations. Question 15. A patient has an MRI of the cervical spine without contrast. A. 72,141. B. 72,142. C. 72,146. D. 72,147. Answer: C. 72146. This question requires selecting the correct MRI code based on the body area and contrast use. The documentation specifies cervical spine without contrast. CPT code 72146 is the correct code for an MRI of the cervical spine without contrast material. Pay close attention to whether contrast was used or not when selecting MRI codes. Question 16. A patient presents for a CT angiography, CTA, of the abdomen and pelvis with contrast. A. 74,175. B. 74,176. C. 74,177. D. 74,178. Answer: D. 74178. This question tests coding for CT angiography studies covering multiple body regions. CT angiography involves specialized imaging techniques to visualize blood vessels. CPT code 74178 specifically represents a CT angiography of both the abdomen and pelvis, performed with contrast. Codes 74,175 to 74,177 are for standard CTs or different CTA regions. Question 17. A patient undergoes therapeutic embolization of a cerebral aneurysm. The radiologist performs the selective catheterization and embolization. Imaging guidance is integral to the procedure. A. 61,624. B. 61,626. C. 61624, 36200. D. 61626, 36200. Answer: A. 61624. This question focuses on interventional neuroradiology coding, specifically embolization. CPT code 61624 is for therapeutic embolization of a cerebral aneurysm. This code is comprehensive and includes the necessary selective catheterization and imaging guidance used during the procedure. You would not code the catheterization or guidance separately. Question 18. A patient requires an ultrasound for guidance during a breast biopsy procedure performed by a surgeon. A radiologist provides the ultrasound guidance service. A. 19,083. B. 19083, 76942. C. 76,942. D. 19083, 26. Answer: C. 76942. This question tests coding for imaging guidance provided for another physician's procedure. The surgeon performs the breast biopsy, while the radiologist provides only the ultrasound guidance. CPT code 76942 is specifically for ultrasonic guidance for needle placement, which includes biopsy, aspiration, and injection. The surgeon would code the biopsy, likely from the 19081, 19086 series, and the radiologist codes the guidance. Question 19. A patient has a chest X-ray ordered as a single AP view. A. 71,045. B. 71,046. C. 71,047. D. 71,048. Answer: A. 71045. This question revisits basic chest X-ray coding, focusing on the number of views. A single AP view means only one view was obtained. CPT code 71045 is used for a chest X-ray with a single view. Counting the views documented is the key to selecting the correct code in this series. Question 20. A patient undergoes a limited echocardiogram specifically to assess left ventricular function. A. 93,000. B. 93,303. C. 93,308. D. 93,320. Answer: C. 93308. This question tests coding for echocardiograms, a type of ultrasound of the heart. The term limited echocardiogram and the focus on left ventricular function point to a specific type of study. CPT code 93308 is used for a follow-up or limited echocardiographic study. Full comprehensive studies are coded differently, e.g., 93,306 or 93,307. Question 21. A patient requires placement of a peripherally inserted central catheter, PICC line. The radiologist places the PICC line under fluoroscopic guidance. A. 36568, 77001. B. 36569, 77001. C. 36,568. D. 36,569. Answer: B. 36569, 77001. This question involves coding PICC line placement with imaging guidance. CPT code 36569 is for the insertion of a PICC line requiring imaging guidance. Because the radiologist provided the fluoroscopic guidance, CPT code 77001 is coded separately for the imaging service. Note that some PICC insertion codes already include imaging guidance, so checking the specific code description is crucial. Question 22. A patient undergoes an MRI of the lumbar spine with contrast. A. 72,146. B. 72,147. C. 72,148. D. 72,149. Answer: D. 72149. This question tests MRI coding for the lumbar spine based on contrast use. The documentation states lumbar spine with contrast. CPT code 72149 is the correct code for an MRI of the lumbar spine performed with contrast material. Make sure to differentiate between codes for without contrast, with contrast, and with and without contrast studies. Question 23. A radiologist performs a complete diagnostic ultrasound of the pelvis, female. A. 76,856. B. 76,857. C. 76,830. D. 76856, 76830. Answer: A. 76856. This question tests coding for female pelvic ultrasounds, specifically a complete study. CPT code 76856 is for a complete diagnostic ultrasound of the pelvis in a female patient. Code 76830 is for a transvaginal ultrasound, which is a different approach and code. Always confirm the type and completeness of the study from the documentation. Question 24. A patient undergoes a diagnostic coronary angiography with selective catheterization of the left and right coronary arteries. A. 93,454. B. 93,458. C. 93,459. D. 93454, 93458. Answer: C. 93459. This question involves coding diagnostic coronary angiography, a key cardiovascular interventional radiology procedure. CPT code 93459 is used for diagnostic coronary angiography that includes selective catheterization of both the left and right coronary arteries. This code is comprehensive and includes the necessary imaging supervision and interpretation. Codes 93454 and 93458 represent studies of only one side or bypass grafts. Question 25. A patient receives a single photon emission computed tomography, SPECT, study of the brain. A. 78,607. B. 78,608. C. 78,803. D. 78,816. Answer: B. 78608. This question tests knowledge of nuclear medicine brain imaging codes, specifically SPECT. CPT code 78608 is assigned for a SPECT study of the brain. Codes like 78607 are for planar brain imaging, and 78,803 or 78,816 are for tumor or PET imaging, respectively. It is important to identify the specific nuclear medicine technique used.